So hi everyone and welcome back to Little Growing Bones. Today we'll be diving into an important topic for parents and caregivers, and that is hip fractures in children. So while they aren't so common as other injuries, knowing what they look like, what are the potential risk factors for these is very crucial for every parent. So let's get started. So as we know, kids are naturally energetic and adventurous, and while this is wonderful for their growth and development, it also means that they are prone to injuries. So among these injuries is hip fractures, and these hip fractures are quite unusual in children, but they can happen, especially in certain situations. So what exactly is a hip fracture? Simply put, it's a break in the upper part of the femur or the thigh bone near the hip joint. In children, these fractures often result from high impact injuries like car accidents, sports accidents, or a fall from a significant height. So I do have a model of a hip joint here. So the hip joint comprises the ball and, in this model of the pelvis, the socket. All right, so the ball, which is the head of the femur, sits into this socket. All right, and that is what makes up sits into this socket, and that is what makes up the hip joint. In hip fractures, it's basically fractures that involve this complex, that hip joint. But when we're talking about fractures around the upper part of the femur or the upper third of the femur, it's fractures from the head extending into this area we call the intertrochanteric area. What are the symptoms of hip fractures? So if a child has a hip fracture, they'll likely have one of the symptoms below. So they will experience intense pain. They'll experience intense pain of the hip or the groin. They'll have inability putting weight on that leg. They could have difficulty moving that leg. Sometimes you'll notice that there's swelling and bruising on that area or on the leg. The leg could appear shorter and turn outwards. So we can't talk about hip fractures without talking about a vascular necrosis of the femoral head. Now, here's something very important to understand. The risk of vascular necrosis or AVN in hip fractures is something that is important for us to know, is something that is important for the parent to know. So a vascular necrosis, like we talked about before, is a condition where the blood supply to the femoral head is disrupted, causing the tissues around that head to die. So it is a serious complication, and the likelihood of this happening depends on where the fracture is located. So if I go back to this model of the bone, in fractures that are very close to the head, it increases the risk of vascular necrosis markedly. While fractures that are farther away from the head, it reduces the risk of vascular necrosis. But for example, a fracture close at the femoral head, what we call the intracapsular fractures, carry a higher risk of vascular necrosis because the blood supply to this area is more vulnerable. While fractures that are farther away, like farther down, or those like at the intertrochanteric fracture, or those at the intertrochanteric area, carry a much smaller risk. How do we treat hip fractures in children? So the good news is that these fractures are treatable and they do heal. The mainstay of treatment is surgery. So the role of the surgery is to realign the bones. And after the bones have healed, then we continue with the physical therapy to help with the full recovery. So because children's bones are still growing, they tend to heal relatively faster. So of course, early treatment is key in avoiding complications. So if a hip fracture is suspected, then please don't wait. Take the child to the hospital as soon as possible. Get them the medical care right away. So that's it for today, and until next time, keep it on Little Growing Bones.